The areas that staffing shortages have hit hard is the healthcare industry. KQ2's Jackie Elson explaining how a hospital in Kansas City has dealt with the problem.
The pandemic has caused staffing shortages in all industries across the world, but one of the most crucial that has been impacted is healthcare.
Healthcare was, facing this battle of all the opinions, and so it became very frustrating for a lot of the healthcare workers.
Children's Mercy of Kansas City is just one of thousands of hospitals affected by staffing shortages after employees either go out sick with COVID-19 or they leave healthcare after feeling burned out.
So we saw a lot of people leaving the field of healthcare. The timing of everything was very challenging. So over the course of, the last 2 years, we've seen a lot of people leave healthcare in general.
Dr. Watts says that with Children's Mercy being a specialty hospital, they don't just have kids sick with COVID, but also children with pediatric illnesses that need proper care.
There were a lot more children hospitalized with Omicron than any other surge that we've seen. Some children can be handled at the place where they live in their nearest hospital, but then the sicker they are, the more likely they are to be referred to us.
The hospital has asked for pediatric nurses and respiratory therapists, among many other jobs, who have retired or recently left healthcare to come and work temporarily.
We are hiring some traveling nurses. We are hiring some seasoned nurses from other facilities. We have had some nursing staff that have come out of retirement or that only wanted to work part-time. We've had graduate nurses come and get hired right out of school.
Dr. Watts says that Children's Mercy will get you trained and skilled to the right level you need to be at.
So we have rigorous training programs, orientation programs for all of our staff, whether that's nurses, physicians, ultrasound techs, lab techs, anybody that comes in that we hire.
Dr. Watts says that after improvising operations at the hospital over the last 2 years, she's hoping to see more positive outcomes.
I'm happy to see that children are not getting Omicron as fast as they were a few weeks ago. I think that we are headed in the right direction, and I think it's all positive news, and hopefully we'll continue to do so.
Reporting in St. Joseph, Jackie Elson, KQ2 News.
Staff at Children's Mercy say things are a little better there now than there were a month ago with staff out with COVID-19, but they still do have that shortage.